As with any CPAP therapy, the cannulaide will only be effective with careful positioning to prevent pressure spots from an appliance under tension or the infant lying on tubing. Vigilant nursing care and developmental positioning considerations are critical to the success of CPAP therapy. To choose the right cannulaide, use your patient's weight as your guide. The size weight recommendations on your prongs will coordinate nicely with your choice of cannulaide sizes. Skin preparation is vital for the best performance of the cannulaide. It needs a clean, dry surface to stick to. Our hydrocolloid is as gentle as it can be, so any oils, ointments, or vernix will compromise its ability to adhere to the baby. I use a saline wipe and a 2x2 gauze to clean the nose, cheeks, and lips. Do this 2 or 3 times to prevent having to replace a cannulaide prematurely. Once the face has been properly prepared, the cannulaide will remain effective for 24 hours or more. To apply the cannulaide, peel the cannulaide off the liner and position over the infant's nose. Let the petals fold over so the mustache can be centered on the lip. After the mustache is placed on the upper lip, fold the petals over the nose. Spending a few seconds molding the petals to the nose now will improve the performance of the cannulaide as it melts into place. Notice the narrow strip of low-profile Velcro on the mustache portion of the cannulaide. This will interface with the Velcro loops we will put on the prongs. Applying the soft Velcro loop to the prongs will allow the prongs to stick slightly to the cannulaide. We have found that an over-aggressive Velcro mustache makes removing the prongs for prong care difficult, and it sticks to everything, like Velcroing the baby to his sheepskin. Position the prongs as usual. When using bubble CPAP especially, you will notice a seal is achieved without having to push the prongs in very far at all, and without having to use oversized prongs. In my hospital, we have had great success using the cannulaide as a pressure seal and to address skin breakdown. This hydrocolloid was originally developed as a wound dressing. For prong care, remove the prongs. Inspect the nares with a pen light for signs of redness or irritation. Suction the posterior nasopharynx Q3 to 6, lavaging with a drop or 2 of saline to keep the nasopharynx clear of secretions. With tiny air passages, any built-up secretions can profoundly reduce the effectiveness of CPAP therapy. If there is a change in the baby, the first thing to check is the airway. Suction the baby. It is normal for the cannulaide to whiten around the edges as it hydrates in the warm, humid environment, but as long as the seal remains, the cannulaide is effective. You will become comfortable inspecting the nares with the pen light with the cannulaide in place. By following these simple steps, we know that you will find the cannulaide to be an excellent and effective adjunct to your CPAP therapy. Fewer complications means that your job's easier and the babies get the best possible care.